talk to us a little bit or comment a little bit on actually the veterans themselves participating in their own care and being involved in kind of a shared approach.
We always know that it has to be 50-50. It has to go both ways. Gone are the days where the health provider, in particular the doctors, tell you what to do. That we know that top-down approach doesn't work, but we also know embedded in the military culture is somewhat of that top-down approach. And so we understand that part of that transition requires now this shared dialogue. You have needs that when you express it, allow us to know what your priorities are and how we can start to help you with the transition, but also with the care that makes sense for you and your families. Just because something responds to a medication or procedure doesn't mean that's actually going to solve what is really hurting you. It could be hurting you mentally. Something could be hurting you within the family. Something can be hurting you within the way you function and move a body part. And a single medical therapy is not enough. And that's why when Dr. Buckenmeyer had mentioned this need for a kind of a multimodal approach to, at the same time, address several function and several priorities. We need our veterans and their families actually to share with us what they need from us first, where they're ready to move on their plans. And second, what plans make sense? Because just because a recommendation is made, sometimes the timing's not right. Sometimes psychologically you're not ready. Maybe your body needs actually a graded approach before you can do something that's a little bit more fuller. And also it's the readiness of the whole family, because we cannot leave them behind. Without all of that in terms of support, and some of us, in fact, don't have family, but you have circles of friends and others around you. So we always have to embed your care with the circles, your communities around you. And if you don't have a community, that's even more important why this dialogue needs to be very open.